Barbara Isaacs-Welds. I'm a registered doctor in Kingston, Jamaica. I graduated from the University of the West Indies all of 50 years ago, and I am in general practice, or what you may all like to call primary care. And I have done this for the last 50 years. Well, bearing in mind that Jamaica is very small, our population is just below 3 million. I would say COVID-19 has had a very serious impact on the population on a whole. And of course, this has therefore affected our practice considerably. In terms of the people, how they've been affected, this affects you on a personal level, this affects you work level, this has affected our worship, our recreation, it has affected how hospitals and nursing homes are being run, and of course it has affected tourism. We still have curfews in place, but these have really been relaxed quite a bit. There were very serious curfews originally, but they're now like from 11 p.m. to 5 a.m., which is really not bad. But there'd been a time when it was sort of early evening till 8 in the morning or something. So we have those curfews, which are island-wide. When they have found cases cropping up in different regions, then they have really closed down those regions, isolated the entire region, and done their investigations within that region. We have an age limit of 65 and over, who are meant to be really just doing more or less essential things. They're allowed to go to the pharmacy, the supermarket. They've added church to that list. But this is with the proper prevention, which is our mask, physical distancing, and using the proper hand sanitizers, etc. So right now, we still don't have places like bars and nightclubs, and those places are not yet open. Restaurants, we can get things to take out, and we can have other activities. They open the beaches. They still limit the gatherings. Churches are allowed to have bigger numbers if they're big enough that they can allow the 6 feet physical distance in front, behind, and beside the person. So all of this has to be put in place. In our center, I would say we had to put certain regulations in place. And once we were impacted by this, or just prior to it getting serious, we had to, for instance, begin a screening method, in which we employed a medical person to be at the front of the building and to screen everybody who entered the building. And we actually had a screening questionnaire which we used, allowing them to give us their name, address, contact number. And we had some simple questions that they had to respond to, like if they were having any symptoms such as fever, shortness of breath, cough, respiratory symptoms, also diarrhea, vomiting. And we also asked them about their travel history. This is for their protection as well as for protection of our staff, so that we would know if there was anybody that was high risk, and those would be taken off to a particular area where they would be dealt with, okay, and possibly referred to hospital if there was a need. So when we see the patients in our general practice, they've already had a baseline screening, and we know that they're not an emergency and not likely to be, affected by this virus. For my personal practice, I do a lot of medicals, but of course, these people are also at risk because I see patients or people who are going to be employed on cruise lines, people who are going to migrate to Canada. This is a big part of what I see. People who are going to be employed at various companies who do a pre-employment medical examination. So although they are quote unquote healthy or presumably healthy, they have also been exposed. So we have to screen them carefully. On the whole, the people are cooperating. I will admit the young people tend to be the ones that maybe they're rebellious anyway. You sometimes see them and they're not wearing masks, or they're playing a football game or soccer or something. And every now and again, the police have had to shut down a party or two. But on the whole, the people have cooperated. And this even goes for your little, for your average work person, pedestrians, people going about their business, going on, particularly in like taxis, which are a very common form of public transportation here. So they wear their mask and the driver wears a mask and they try to keep safe. And they've even restricted the number of people that are allowed in a taxi, because sometimes those vehicles could be very crowded. So I think we're cooperating on the whole. I think my fear is that now that things seem to be, I don't know, flattening, I don't know what word to use, people may become a bit complacent, which is so dangerous. So I keep reminding people we still have to be on the alert, and it's not all over at all yet. So this is what's happening. I think also our elderly people have been really very careful. The hospitals have reduced their visiting times, and they restrict the number of visitors to each inpatient. So this is all, very effective as well. What I will say I'm particularly interested in, apart from a vaccine, is I would love to know what is the possible connection with the BCG vaccination, because what we know is in Jamaica, we have not had many. In fact, I don't want to say any. We've had a few deaths, yes, and these people apparently have had comorbid conditions, but we don't seem to have had this severe respiratory failures, etc., and multi-organ damage that we have known of happening abroad. And in fact, right now, when I went through some figures the other day, we had no critically ill, no moderately ill. So we seem to, when we do get it, do very well, I'd say, and recover. So I'd love to know, what is the connection? Well, as I say, we have to follow the guidelines of the Ministry of Health and the Prime Minister, the Minister of Health and the Prime Minister. We have to, where possible, stay at home, cut down our exposure, particularly the seniors. We have to, when going in public, be sure to wear the mask. We have to be sure to wash our hands or use sanitizer, and we have to maintain that physical distance. I say this tongue in cheek because as a doctor, I cannot maintain a physical distance once I'm here. But, that is within limits, obviously. I think also, the mental approach is very important. I think we have to maintain that sort of positive attitude, because like in so many things, in any chronic illness or any disaster, I think if you throw your hands in the air and give up, it's likely to have an unfortunate outcome. So I think you have to maintain a positive attitude, and eventually, we don't know when, but it will all work out. As I said to a patient today, we all want to see in the future, but we were never able to. So why do we think that during COVID we're going to know when it's going to end and how it's going to end? We just have to have that faith and trust. So I think that's important. I think also, particularly for the elderly, I could never say that I was bored when I was at home, and I was at home from the middle of March, perhaps, until the 1st of June. Keep occupied physically, mentally, keep in touch with people, whether on the phone or Facebook, WhatsApp. I mean, these things, we are blessed to have these media opportunities because really it allows you to be in touch. This is pretty new to us, but we're all on WhatsApp and YouTube and Facebook, and so we're streaming, and this is wonderful. I think if you really protect yourself, you keep positive, and you keep in touch. I think one of the sad things is when people feel isolated. whether they're ill or just being ignored. So we have strengthened different friendships and groups that I'm in to keep in touch with people. This is important. Just to find out how they're doing. Sometimes you can do something for them. And I tell people who are bored, go and help somebody, or call them. So this is good.